All right, friends, Dr. Cherry here. Welcome to my little corner of the internet. It's Think Like a Nurse Tuesday, covering prioritization, safe delegation, case studies, and challenges. So let's talk. Remember, nursing is not about memorizing, it's about learning to think. Three patients need you, but one could crash. Who are you going to see first? This is the one type of question that can make or break your NCLEX scores. Do not choose patients based on diagnosis. Choose based on the cues. Most students start by looking at the diagnosis, but nurses do not prioritize by diagnoses. They prioritize who is most likely to get worse. Let us try one. Which patient would you see first? A, a client who has is 1 day postoperative following abdominal surgery, reports of pain 8 out of 10. Vital signs are blood pressure 128/76, heart rate 84, respiratory rate 18, temp 98.8 degrees Fahrenheit, 37.1 degrees Celsius. Patient B, a client with COPD, has an oxygen saturation of 89% on 2 liters per minute via nasal cannula, which is the client's prescribed baseline. The client denies shortness of breath. C, a client with heart failure develops new crackles in both lung spaces, increasing shortness of breath, respiratory rate of 30, oxygen saturation of 91% on room air. Pause. Take a moment to think about it. The answer is patient C. Do not ask which patient looks the sickest. Ask who is changing. This patient suddenly becomes short of breath. Who has the highest risk of dying? If I wait, pulmonary edema can quickly become into respiratory failure. What follows the ABCs? Airway, breathing, circulation. Patient A is uncomfortable but stable. Patient B, oxygen level is expected for many COPD patients. Patient C has an acute change that threatens breathing. This is the patient you will see first. Thinking like a nurse is not about memorizing diseases. It is about recognizing the cues, identifying what is most dangerous, and acting before your patient crashes. That is exactly what clinical judgment and the NCLEX are looking for. Which patient would you see first and why? Remember to follow along, invite a friend, share those videos. You never know who might need an encouragement, a new study tip, or a reason to smile today. Until next time, keep learning, keep laughing, and keep living the real life.